Let me introduce our first speaker, Riccardo Lazzaro. Mr. Lazzaro is a health coordinator at Doctors with Africa, CUAMM, in Ethiopia. He is going to be presenting on the preliminary results of BabyChecker use, an AI that analyzes ultrasound scans in the Somali region of Ethiopia. Riccardo, the floor is yours.
Thank you very much. Nice to meet you, everybody. As was introduced, I'm Riccardo Lazzaro, Health Coordinator for QAM Ethiopia, Doctors with Africa QAM. Next slide, please. Okay, here is the preliminary results of a BabyChecker use, AI that analyzes ultrasound scans in Somali region, Ethiopia. This is the group of people that collaborated with this research. Most of us, we are from Doctors with Africa QAM, plus some people from Delphi Imaging and the Somali Region Health Bureau. Next slide, please. Okay, a small introduction about Doctors with Africa QAM. We are an NGO, the first Italian international health organization established in 1950. It's active even in Ethiopia since 1980. Aiming to strengthen health system and improve sexual, reproductive, maternal, neonatal, child, and neonatal and nutrition services. QAM began operations in Somali region in 2020. In October 2024, as part of one of its projects funded by Fondazione Elena, QAM piloted the use of BabyChecker at the Dawanaji Health Center in Fanfan Zone, Somali region. Next slide, please. Okay, about the background, in Ethiopia, we have high maternal and neonatal mortality. Most of deaths are preventable with timely risk detection and skilled care. In Ethiopia, limited ultrasound access in rural area hampers early detection of pregnancy risk, such as malnutrition, malpresentation, placenta previa, and multiple gestation. WHO recommend early obstetric ultrasound as a core component of routine antenatal care, but is not widely available outside urban centers and area. Innovative tools such as BabyChecker may empower frontline health workers to detect pregnancy risk early and improve antenatal care uptake. Next slide. Briefly about BabyChecker, I think there were quite a competent and big introduction about it. BabyChecker is an artificial intelligence device that analyzes obstetric ultrasound scans to identify potential risk factors in pregnancy. Scan can be easily acquired with a point-of-care ultrasound and by a frontline healthcare worker within 2 minutes. A frontline healthcare worker can be easily use the ultrasound without prior experience. BabyChecker was developed by Delphi Imaging with the collaboration of various partners, and the first version was launched in 2023. Next slide, please. Okay, let's go to the preliminary study result. The primary objective of the study was to assess the BabyChecker usability, comparability, and adoptability for the practical use in the clinical setting and strengthening the antepartum care in the rural setting in Ethiopia. The secondary objective of the study was to ensure that BabyChecker use is helping to achieve the following key outcomes: increase the identification of pregnancy-related risks, such as risky placenta localization, fetal malpresentation, multiple pregnancies, and other risks detected outside the typical antenatal care indications. Additionally, increased number of antenatal care attendance and frequency of visit, including earlier attendance. Next slide. So the study setting, as we say, Darwanaji Health Center in Somali region, Ethiopia. The time frame of the study was October 24, June 25, for a total of 9 months. The context was a rural primary healthcare facility providing antenatal care and skilled birth attendance with a delivery room. The support of the study mainly was, can you still hear me?
Yes.
Yes.
Yeah. Okay. Okay. Sorry. Sorry, the connection is not stable today. I was saying the support, the implementation was done by Doctors with Africa QAM in collaboration with the Somali Regional Health Bureau. Midwives were trained and supervised on BabyChecker use, and midwives were the one of the health center. Next slide. Study design. The study was a facility-based prospective pilot intervention design study using a pre and post comparison design. Study participants and sampling, inclusion criteria, pregnant women visiting for antenatal care or stillbirth attendance at the Darwanaji Health Center during the study period. The follow-up was with women with identified risk that were rescan and refer as needed. Next slide. Data collection and method. The tools we used were basically the antenatal care facility registry and the daily registration book for data recording of the BabyChecker. Concerning the monitoring, in October 24, all midwives were trained using the tutorial video that was shown before this presentation and started the on-job training. In January 25, an expert obstetrician gyne gave a technical support to the midwife on the ground. And between October 24 and June 25, the monthly supervision and mentoring by a trained health officer was done, and data collected were collected monthly on a dedicated record. Concerning the data quality, the performance were automatically transmitted to Delph Imaging for cross-checking and a third-party verification of dedicated records with Excel MS database was done, particularly by our regional head of program. Next slide, please. Concerning the data utilization and data analysis, we made for this initial part, we did the descriptive statistic, so frequency, percentages, means, and ranges to summarize participants' characteristics, scan quality, and antenatal care attendance. We are planning to have a pre and post 1 year intervention, intervention, monthly antenatal care visit, first trimester, contact, and follow-up visit compared. The tool was Excel MS, and the association is in plan to have exploratory analysis to examine the relationship between scan findings using Stata 18. Next slide. Ethical approval was obtained by the Somali Regional Health Bureau in October 24, and the verbal consent were also asked to all participants. Next slide. Here we are with the key result of the preliminary finding. A total of 2,830 visits were done during the 9 months data collected. The total scanned women were 138 women. Regarding the risk detection by the BabyChecker system, 21%, meaning 29 fetal presentation, and 25 low-laying placenta cases were identified. Referrals, 5 women were referred to a higher level of care versus 20 patients that had to be referred by the system. 120 were the women that receive a follow-up at the Darwanaji Health Center. On the right hand, you can see that initially we had a kind of standard antenatal visit with a midwife. Here there is a mistake. General practitioner is not present in the health center. Suspected obstetric complication were sent for the BabyChecker visit. And then those who where the complication were confirmed, when the complication were confirmed, were referred, were suggested to be referred to a higher level of care. Next slide. Concerning the scan quality. Sorry, concerning the scan quality. Can you go, sorry, previously? To the previous slide? Yeah, thank you. Scan quality, we have 65% scan sufficient quality. Usability, 11 patients out of 138 were rescanned. We found that while midwives found BabyChecker user-friendly and reliable, the performance seems to change from person to person. We can see from the table below the use.
Unfortunately, we can't
Can
hear
you hear
you,
me?
Riccardo. Yeah, now we can hear you.
Yeah, you can still hear me. Okay.
Perfect.
So I was saying user B got 100% the percentage sufficient scans, while user E had only 20% sufficient scans. Next slide, please. Okay, concerning the comparison, 6 months comparison, January-June 24, January-June 25, we realized there were quite a big increasement. We can find in the second column the first period, and in the third column the second period. So antenatal contacts were averagely 280 in the first period, 330 averagely per month, 338 in the second period, with a plus 20% difference. Total first antenatal contact were 52 in the first period, 55 in the second period as monthly average, with almost 6% plus difference. Total first antenatal care contact in the first trimester were 24 in the first period and 26 in the second period as monthly average, with a plus 8% difference. And surprisingly, the visit, antenatal care visit 7 and 8 were 0 in the first period and around 67 in the second period as monthly average. I have to say here, this attracted quite a lot our attention, so we are going back to the records to understand, and it seems that it was a problem, not a quantitative problem, but more a qualitative problem of data that were not collected properly and were kind of informal visits that were done. So were not recorded, and that's why we have a 0 in the first period. But as I say, these are preliminary findings, so things might be different, slightly different from these findings. Next slide, please. So limitation of this study, preliminary results are limited by a sample size and short follow-up and require confirmation in large-scale studies. The technologies of potential to facilitate early complication detection may be undermined by cultural barriers, patient economic challenges, and health center logistic issues, collectively impeding a timely referral to hospital care. Consistent training and supervision will be key to sustaining high standards of use and maintain appropriate records. Next slide, please. discussion support WHO, the study support WHO recommendation for early obstetric ultrasound and align with studies showing AI-assisted tools can improve risk detection in low resource settings. BabyChecker seems to be a feasible, user-friendly, and effective for detecting pregnancy risk in rural antenatal care setting, where a source of electricity is available. I've heard in the previous presentation that the level of battery and the presence of electricity is quite the key, and we found that is also important because the battery can finish soon. Additionally, antenatal care reattendance increased more than anticipated. Scan quality was high despite minimal training, indicating rapid adoption and acceptability among midwives. However, more comprehensive training may be required for center members of the team. Next slide. In conclusion, preliminary findings show that BabyChecker initiative demonstrated a high practical, user-friendly, and adoptable solution for improving ultrasound screening in rural areas. The implementation also showed that BabyChecker can play a vital role in early identification of pregnancy-related risks, facilitating prompt referrals and timely intervention, and maybe contribute to improve antenatal compliance. Cultural and logistic challenges should be addressed before starting the implementation. Moving forward, expanding the use of similar technologies to additional rural health centers is critical to achieving wider and higher impact. Next slide. Here we have some pictures of the implementation. In the center up, you can see how in these health centers, but is quite common in the area. They are having banners all over the health centers to show the performance, the monthly performance and the yearly performance of the antenatal care. In the center low, you can see the ambulance that was used by the project and by the health centers for referral. On the right-hand side, you can see a healthcare worker that is working and using the BabyChecker on a woman. On the left, finally, you can see the BabyChecker use. Here I found it interesting to highlight that there are scars on the belly of the patient, of the woman. This is quite typical in the Somali culture. Whenever a lady has some problem and some issue related to the pregnancy, they make scars to bring better to bring good luck. Next slide, please. Thank you very much. In Amharic is Amasagyana.